Hi, my name is Jen Story. I'm a physical therapist at Mangiarelli Rehab. We are at the end of tennis season, and guess what I have? I have tennis elbow. So what I have is pain on the outside of my elbow, right on the bone. It's called lateral epicondylitis, and it's usually an overuse repetitive injury. Could be from playing tennis. It could be from using a hammer, being a butcher. There's lots of other repetitive activities that could trigger this. So I'm really point tender around the outside of my elbow and into the tendon. I don't really have too much pain or symptoms into my forearm or my wrist and hand, but it's just very annoying. So a couple things that I've done to try to help reduce my symptoms and get my arm back to functioning pain-free is I do some deep cross-friction massage on it, right where the bone and the tendon meet. Not for very long because it does make you awfully sore. So just for maybe 2 to 3 minutes, I sit there and I'll just really dig in there, massage, just to help bring blood supply to that area, to help stimulate some healing. So that's the first thing I'll do. I've been using ice a lot on it at night, especially if it aches, or I take ibuprofen. But that's something you'd have to talk to your doctor about to help with inflammation. Another thing is I've done ultrasound on my elbow. This is just a form of deep heat. It's sound waves, it's painless, and I will set up the settings to the appropriate parameters and then just massage the gel around the tendon where it's sore. That's supposed to be helpful with increasing blood flow, to help with healing, reducing pain, inflammation. So that usually feels pretty good too. Another thing I've tried is dry needling, and in a moment I'll show you what I put. And what I use is a filament needle, similar to acupuncture needles. And I only have 2 placed in my arm right now, but I could really probably use a couple more down through the forearm area. And I'm just following the path of the tendon through the muscle, where the tendon inserts into the elbow. Also, you can make the stimulation even more effective if you hook up electrical stim to the needles, and that might also give you more intense effect and reduce your pain too. But we're not going to do that today. So usually with dry needling, I keep the needles in maybe 5 to 10 minutes, and that's about all that you really need to get the results that you want. One more thing that I've been doing is eccentric loading of my wrist extensors. So what I do is I extend my wrist up, place the 2-pound weight in my hand, and then slowly lower it. Release, lift up, put the weight in, and lower it. Okay, so this is just a nice way to try to regain some strength and function back in that wrist extensor muscle without causing any more inflammation. And after I'll try to do about 2 sets of 15, and my arm will start to fatigue after a while. You can start with a 1-pound weight, then eventually, if it gets easy, go to the 2-pound weight. But usually, for me, 2 to 3 pounds is enough. So that's about it. If you have any questions regarding this diagnosis, feel free to give us a call, and have a wonderful day.